So welcome to this new case of the liver pathology slide review. It's a classical, straightforward case, but it's a classical trap that you will have to remember. So here is below the information if you want to access the whole slide on Crosscope. Case number 4, so it's a patient with 3 liver nodules that are suggestive of metastasis. They have been discovered incidentally. So one of them is biopsied, and now let's go to the slide. So let's have the look at the 2 fragments of this biopsy. You have here some non-tumoral liver with a portal tract here, some blood here. And when we go to other areas, you see some fibrotic areas with here some vessels. Again here, some vessels, fibrosis also, and probably some veins. And when we go to the other fragment, you have the same kind of appearance with this fibrosis and these cavities with blood cells inside. You see the endothelial cells. The nuclei are normal. There is no atypia. So what we have here is probably an hemangioma that has undergo fibrosis, maybe partial thrombosis. So there is no malignant proliferation on this biopsy. It's a good news for the patient, and it's a classical trap for radiologists because when the angioma is atypical and fibrotic or has undergo thrombosis, its appearance may change and it may look like metastasis. So in this case, the biopsy is likely an hemangioma, so good news and no malignant proliferation. So it's a classical trap. So the take-home messages are that the diagnosis of hemangioma is usually performed only by imaging, and the lesions are biopsied when they are atypical. They often are atypical when they undergo thrombosis and subsequent fibrosis. And so you have to think of hemangioma when you are looking at a biopsy performed on what is called the tumor, and you see fibrosis and vessels. And also you can do some additional stainings like CD34 if you want to see the endothelial cells. Thank you.